My name is Britney Lamarche, and I'm a Master of Applied Science student at Laurentian University. Today, I'll be discussing my research on changes with age in the trabecular bone structural units, or BSU, of the lumbar spine. Age-related factors affect a large portion of the population, and most commonly occur in skeletal sites with high proportions of cancellous bone, such as the hip, wrist, and spine. Cancellous bone, oftentimes called trabecular bone or spongy bone, is a highly porous material composed of a series of interconnecting flat plates and cylindrical rods, called trabeculi. With age, there's a loss of bone mass and deterioration of the tissue's architecture, leading to increased fracture risk. The World Health Organization estimates there's a 30 to 40% lifetime risk of fracture in developed countries, and this number is only expected to rise with aging populations. Because of this, measures of bone quantity, such as bone mineral density, which provides information on the 2D apparent density of cancellous bone, are used to assess fracture risk in the elderly. However, these have been shown to be imperfect predictors of fracture risk, and the focus has now shifted to measures of bone quality, such as 3D architectural parameters and tissue properties. Despite increased attention to the quality of bone, very little has been investigated at the bone structural unit or BSU level. The trabeculi that make up cancellous bone are themselves composed of a patchwork of new and old bone regions called BSU, but they may also be called trabecular packets or hemiostiones. These are formed through the remodeling process, where osteoclasts remove a portion of bone at the trabecular surface and osteoblasts lay down new tissue in its place. These BSU are separated from one another by a highly mineralized material called cement line, whose properties are not yet well understood but are thought to be hard and brittle. We believe that changes in the shape and distribution of BSU could impact the mechanical and fracture behavior of cancellous bone. So our goal was to quantify these changes with age and with 3D architectural parameters. The second lumbar vertebra from 8 young and 8 old Caucasian women were used in this study. They were selected as a subset, based on age, from among 41 vertebrae that underwent micro-CT imaging and architectural analysis as part of a prior study. 9 mm thick frontal sections from one half of each vertebra was embedded and provided for use in the current study, as the other half was used in prior destructive analyses. The 3D architectural parameters of the 16 vertebrae that were obtained from the prior study were provided for use in the current study. The two most important parameters in today's talk are bone volume fraction and structure model index. Bone volume fraction, abbreviated by BVTV or bone volume per total volume, indicates the percentage of volume occupied by bone, which tends to decrease with age. Structure model index, which is a number between 0 and 3, indicates the degree to which the trabeculi are plate-like, which would be a number closer to 0, or rod-like, a number closer to 3. With age, structure model index, or SMI, increases, so trabeculi become more rod-like with age. We also considered connectivity density, trabecular thickness, trabecular separation, and trabecular number, all of which are described in the table. From each of the 16 vertebral specimens provided, a 7 micrometer thick frontal section was cut using a microtome. The sections were then stained using an osteopontin immunohistochemical staining procedure, which targets the osteopontin-rich cement lines separating the BSU from one another. The stain turns the cement lines bright pink, allowing the perimeter of each BSU to be visualized. The stained sections were then digitized using a Hamamatsu high-resolution scanner. From these scans, a 75 mm square midvertebral region was identified for analysis. Each of the BSU within this region was manually traced in ImageJ image analysis software. The area, thickness, measured as the diameter of the maximum circle within the selection, and the direct length was recorded for each. Additionally, 2 trabecular profile-specific parameters were measured. A trabecular profile, for the purpose of this study, was defined as a discrete and continuous area of trabecular bone in the 2D section, as may be observed by the profiles identified in the figure here. From each profile, the number of BSU within that profile and the length of cement line within that profile were recorded. These two parameters were always normalized by the area of the trabecular profile. When the osteopontin staining wasn't clear, the slides were viewed under a polarized light microscope to visualize the distinct lamellar orientations of adjacent BSU. Our first analysis set out to quantify the overall differences in BSU morphometric parameters between the young and old age groups. Differences were considered significant if they had a p-value smaller than 0.05. Mixed effect models were used for these comparisons to account for the nested nature of the data, the positive skewed distributions, and the unequal number of BSU measured from each vertebra. From gamma, negative binomial, and Gaussian mixed effect models, the best fit was chosen to characterize and compare the distributions. BSU area and thickness both followed gamma models, but were not found to be significantly different between the two age groups. BSU length, however, followed a negative binomial model and was found to be significantly smaller in the old age group. The median values for each parameter for the young and old age groups are presented in the distribution plots below. When analyzing the distributions of the trabecular profile parameters, it was found that the number of BSU per profile area followed a gamma model, while the cement line length per profile area was best described by a Gaussian model. Both were significantly larger in the old age group compared to the young. Linear regression was then performed to determine if there was a relationship between the individual's median BSU parameters and their age. The mean, rather than the median, was used for cement line, since it followed a normal distribution. Significant linear correlations were found with BSU length and the number of BSU per trabecular profile area. BSU length decreased with increasing age, and the number of BSU per profile area increased with increasing age. These were the only two BSU parameters that demonstrated a significant linear correlation to age. Individuals' median BSU parameters were then analyzed as a function of their bone volume fraction. It was found that all parameters demonstrated a significant linear correlation to bone volume fraction. BSU area, thickness, and length increased with increasing bone volume fraction, whereas the number of BSU per profile area and the length of cement line per profile area decreased with increasing bone volume fraction. This means that as bone volume is lost, BSU becomes smaller, and as a result, there are more BSU per unit area and more cement line per unit area. Additionally, median BSU parameters were all found to be significantly linearly correlated to structure model index. BSU area, thickness, and length decreased with increasing structure model index, and the number of BSU per profile area and the length of cement line per profile area increased with increasing structure model index. This means that as trabeculae are shifting from more plate-like to more rod-like, the BSU within them are becoming smaller, and as a result, there are more BSU per unit area and more cement line per unit area. No other 3D architectural parameters were found to be significantly correlated to BSU parameters, except for trabecular thickness, which was positively correlated to BSU thickness. In summary, a total of 16,851 BSU and 1,137 trabecular profiles were measured from the lumbar vertebrae of 8 young and 8 old individuals. BSU length was found to decrease with age, while the number of BSU per profile area increased with age. Additionally, it was found that the old group had significantly higher proportions of cement line than the young group, which could have implications for fracture risk. Because cement line is highly mineralized, it's presumed to be harder and more brittle than the surrounding bone. Some studies on cortical bone have shown that a hard and brittle cement line, and higher proportions of it, negatively affects the fracture behavior of cortical bone, and we would expect similar results in cancellous bone. Changes in the size and distribution of BSU as a function of architectural parameters have also been investigated for the first time. Contrary to age, all 5 of the 2D BSU parameters analyzed were significantly correlated to bone volume fraction and structure model index, which shows that these architectural parameters are better predictors of bone quality at the BSU level. The mechanical consequences of decreasing BSU size and increasing proportions of cement line with deteriorating architecture require further investigation. I'd like to thank NSERC and MIDAX for providing funding for this study, my supervisor and Danish co-authors for their support, Dr. Bruce Odson for his help with statistical analysis, and the facilities where my research was performed. Thank you for viewing my presentation, and thank you to the Northern Health Research Conference for allowing me to show my research. If you have any questions concerning the contents of this presentation, please feel free to contact me at my email address listed here.